Good afternoon and welcome to today's Educator Effectiveness Webinar Series event. Today our topic is Educator Effectiveness and Healthier Students are Better Learners. As Amola mentioned, my name is Elizabeth Greniger. I'll be today's webinar facilitator. Joining me is Dr. Charles Basch from Teachers College at Columbia University. Before I give you the formal introduction of Dr. Basch, I'd like you to tell us who you are. We're going to be putting up a poll in just a moment, and this will be your opportunity to click on the role that you best fit. You should see that coming up on your screen. Looks like today's topic has brought in quite a diverse audience. Our hope is that the content of today's webinar will give information for many of you, whether you serve in a school-based support position or whether you are a state-level policymaker. We hope that you'll find something interesting and useful in today's webinar. Great, so we're going to move ourselves right along. As I mentioned, today's featured presenter is Dr. Chuck Basch. He's the Richard March Ho Professor of Health and Education at Teachers College, Columbia University. This is where he's been teaching, mentoring students, and conducting research for over 30 years. He specializes in planning and evaluating health education programs for urban minority populations to reduce disparities in health and education. He's directed about $20 million worth of grant-funded research and program development. His work has also yielded over 125 peer-reviewed publications indexed by the National Library of Medicine, including over 50 papers in the last 5 years. He's been very busy, as you can tell. His current research focuses on the strong link between health and academic achievement. Dr. Basch speaks with policymakers, educators, and healthcare professionals throughout the United States about ways that government agencies and schools can reduce health barriers to learning. Just last month, he facilitated a discussion about health and education at the White House. At this time, I'd like to introduce Dr. Chuck Basch.
Thank you, Elizabeth, and thanks to the whole REL team. You're doing great work to increase communication and through your many webinars helping increase the effectiveness of our educational system. So, healthier students are better learners. For many people, I suspect that's common sense. But it's only been the last decade that research has uncovered the reasons why healthier students are better learners. Before we begin, I'd like to encourage all of you to participate by asking questions and by sharing information from your experience. We have a lot to learn from one another, and together we can build a better learning community to help you succeed in school and in life. The objectives for today's session are to provide strong evidence demonstrating that addressing certain health problems in schools has positive effects on both health and educational outcomes, present the connections between multiple health factors and motivation and ability to learn, describe how schools and districts can develop a program to reduce health barriers to learning, and define ways to support school health initiatives, including policies, professional development, and accountability. What we're talking about today is the future of our country. Nothing's more important to our nation than educating the next generation of Americans. Considerable progress has been realized for many Americans. High school graduation rates were 81% in 2012-13 and are now over 82%, an all-time high. This is a great accomplishment. Too many children and youth living in poverty, however, have been left behind. They do not have equal access to educational opportunity. This situation has persisted for decades and is not what we should aspire to as a nation. According to the 216 update by Building a Grad Nation, 16 states had graduation rates below 70% for low-income or black students, and 11 states had graduation rates below 70% for Hispanic Latino students. Nearly half of the 2014 graduates came from low-income families, but only 74.6% of all low-income families graduate, compared to 89% of non-low-income students. The main scientific premise I will be discussing today is that addressing certain health needs of youth is a necessary but largely overlooked strategy for closing the achievement opportunity gap. This presentation is organized into two parts. In part one, I'll talk about health factors that affect educational outcomes, and in part two, I'll talk about effective and efficient school health programs. No matter how effectively teachers can teach, no matter how rigorous curriculum may be, no matter what standards or accountabilities are put in place, how we finance schools or organize them, the benefits of all these worthwhile initiatives are going to be jeopardized if students are not motivated and able to learn. And what I hope to show you today is how certain health problems, I'll call them health barriers to learning, exert powerful but largely overlooked influences on students' motivation and ability to learn, and in turn on the academic achievement gap. To a great extent, both educational and health disparities are caused by a common set of social, economic, and environmental factors, but they exert strong independent effects on each other. The same population of youth in America is affected by educational and health disparities, namely youth who are living in poverty or in very low-income families. We know that education has a powerful effect on health, on quality of life, and how long we live. My talk today is about how and why particular health problems influence educational outcomes, and more specifically, the achievement gap for urban and minority youth. I'm going to focus on urban minority youth from low-income families, but I think a lot of what I'm going to say is applicable to youth in rural America as well. I think the common denominator is really income. I'm also going to focus on school-age youth, but we know that it's really vitally important to really pay attention to the health needs of children before they even get to school to help ensure that they're ready. And attention in preschool programs is very important. And I'm going to only focus on health issues that can be feasibly and effectively addressed by schools. So schools can't do everything. They can't address all of the health needs affecting students. School leaders need a way to prioritize how to use scarce resources to address the critical health problems affecting students. I have suggested that they use three criteria to prioritize: the prevalence and the extent of disparities, the evidence that certain health problems have causal effects on education outcomes, and the feasibility of implementing effective programs and policies. Based on these criteria, I've identified a list of 8 health barriers to learning that warrant consideration as strategic priorities: vision, asthma, teen pregnancy, aggression and violence, physical activity, breakfast, inattention and hyperactivity, and untreated cavities. As you can see, the magnitude of each of these is very low. Is very high. Before we move on I want to mention 2 other things about this particular list. First of all, mental and emotional health is not on the list, but it must be addressed thematically by any high-quality school health program. That's because it's a cause or consequence for the other problems. The other thing that I want to say is that this is not a one-size-fits-all prescription, rather an illustration of health issues that warrant consideration. Every community and school is different and will not only have different health needs, but different resources available and different levels of political support for meeting different priorities. But as you can see, all of these health issues are highly prevalent. Vision affects 1 in 5 youth. Asthma affects 13% of youth under 18 years of age. 8.6% currently have asthma. That's 6.3 million individuals. Teen pregnancy affects 6% of 15 to 19-year-olds annually. There has been considerable declines in teen pregnancy in the past 25 years, but in 2014, almost 250,000 babies were born to women 15 to 19 years old, and racial and ethnic disparities in teen births continue. The U.S. teen pregnancy rates is still substantially higher than rates in other Western and industrialized nations. With respect to aggression and violence, 20% of high school students report being bullied at school annually. In the past year, 25% of high school students nationally reported being in at least one physical fight, 8% on school property. In the past year, 14.8% of students had been electronically bullied, including being bullied by email, instant messaging, texting, or websites. In the past month, over 5% reported carrying a weapon on school property. Over 7% of students missed one day of school in the last month because they felt unsafe at school or on their way to or from school. Concerning physical activity, more than 2 in 3 don't get enough. Almost 75% of high school students in America had not been physically active, doing any kind of physical activity that increased their heart rate and made them breathe hard some of the time for a total of 60 minutes per day on each of the 7 days before the survey. In contrast, on an average school day, over 30% of students watched television for 3 or more hours per day, and over 40% of students played video or computer games or used a computer for something that was not schoolwork for more than 3 hours per day. Nationwide, over 13% of high school students had not eaten breakfast during the 7 days before they were surveyed, and less than 2 in 5 high school students had eaten breakfast on all 7 days before they were surveyed. More than 15 million children live in food-insecure households in 2014. Hunger continues to be a pervasive problem in America. About 12.2% of 12 to 17-year-olds have received the diagnosis of ADHD. This is the most common type of mental and behavioral health problem affecting youth. A significant proportion of these youth are reportedly under treatment with prescription medications. I should note that many other youth face challenges with inattention and hyperactivity, but they're below the diagnostic threshold. Nevertheless, they still face significant challenges when it comes to focusing attention, which is necessary for succeeding in school. 23% of 2 to 11-year-olds have untreated caries. Early childhood caries affecting children under 6 is a bacterial infection that causes tooth decay. It is the single most prevalent chronic disease of U.S. children. While these health problems affect a large proportion of all youth, as you will see in the next set of slides, each of these health problems disproportionately affects low-income urban minority youth. Vision problems are highly prevalent among urban minority school children. 2 studies that screened students for vision problems in New York City found that nearly 30% of students required further evaluation. A study involving a national sample of more than 14,000 children found that children with special health care needs and Black, Hispanic, and multiracial children were 2 to 3 times more likely than white children to have unmet vision needs. Asthma prevalence for youth in the United States ages 5 to 14 is twice as high for Black versus white children, 18.8% versus 9.4%. The rates for youth of Puerto Rican versus Mexican descent emphasize the need to disaggregate data within the Latino population and to direct established priorities accordingly. Asthma is less of a problem than poorly controlled asthma. Early urban minority youth not only have higher prevalence of asthma, but much higher prevalence of poorly controlled asthma, as reflected by overuse of emergency rooms and underuse of efficacious medications. The birth rate among 15 to 17-year-olds non-Hispanic blacks was more than twice as high, and the birth rate among Hispanics was more than 3 times as high as the birth rate among non-Hispanic whites. While there have been large declines in teen birth rates over the past decades and in the past couple of years, disparities by race and ethnicity continue. Compared with white high school students, black and Hispanic high school students were much more likely to report being in at least one physical fight in the past 12 months before they were surveyed. Almost 1 in 10 Hispanic high school students in America has missed 1 or more days of school in the past month before they were surveyed because of feeling unsafe at school or while traveling to or from school. Nationwide, 15.2% of students had not participated in at least 60 minutes of physical activity on at least 1 day during the 7 days before they were surveyed. Compared with white females, the prevalence of not having participated in at least 60 minutes of physical activity on at least 1 day in the past week was 70% higher among black females. According to a study sponsored by the National Institutes of Health, 77% of white girls and 50% of American girls consumed breakfast on all 3 days assessed at the age of 9. By age 19, the figures dropped to 32% and 22% respectively. While the absolute gap between African American and white girls declined from 20 percentage units to 10 percentage units, the relative gap increased from 35% to 45%. These same disparities are seen in the national high school data as reflected by the Youth Risk Behavior Survey conducted by the Centers for Disease Control and Prevention, where much higher percentages of black and Hispanic students than white students had not eaten breakfast in the past week. The prevalence of ADHD is greater for children in single mother families than in 2-parent families, and in families with income less than $35,000 than over $100,000. Finally, the next slide shows that while early childhood caries is much more common among low-income and ethnic racial minority populations, the prevalence of silence is lower. These data collectively are staggering and are a travesty. But sadly, these data describing the problems are old news. It's now time for our first poll, and then we'll turn to a more positive subject of what we can do to reduce these problems. Elizabeth?
Thanks so much, Chuck. I think that you are absolutely right that the statistics are staggering when you look at them collectively, and we're hoping that folks are maybe hearing something new, but probably not, and I think that that's the reason that many folks are here today with us, is that we're looking for solutions to some of these issues, and I'm glad to know that we'll be moving into that part of the discussion next. Before we do that, I would like to open up this question for our participants and give folks the opportunity to tell us what was most surprising about those statistics that we just shared. You'll see a poll come up on your screen, and we'd just like you to share which of those statistics was about the health factors was most surprising to you, and maybe why, why that was surprising. And while we give folks a few moments to formulate some responses to that question, I will mention a few housekeeping items. We have the PowerPoint down below in the resources to download box. I know folks are interested in having those slides. You can download that copy of the presentation there. if folks are having any technical issues, there's also a box down below where our staff can help you with that or potentially help you with your issues. Our parking lot on the left-hand side can be used for any questions you have for Chuck or any comments you have about the content of the presentation. So I see one there. Claudia is asking if there's any more current data for some of the statistics you shared.
Well, it depends what you're talking about. The data for many of those health issues is quite recent. A lot of the data are drawn from the Youth Risk Behavior Survey, which is conducted by the Centers for Disease Control, and those data about physical activity and missing school and aggression and violence are based on 2013. The 2015 data will be released actually later this month. And in some cases, for the most part, they're for the most part fairly up-to-date data. In some cases, like with respect to vision problems, there really isn't good quality, frequently updated information. And I think that's something that we hope can change.
Great, thanks, Chuck. You'll see a lot of responses coming in here from folks, lots of surprising, really run the gamut here, you know, what folks are surprised about. Go ahead.
Sorry to interrupt, Elizabeth. The comment that I like is nothing at all was surprising about any of the data. I have practiced pediatrics in Newark, New Jersey for the past 35 years, and I see all of this. And I suspect that there's people all over America that would have the same reaction. This is old news. These problems have persisted for way too long, and now is the time for them to be changed.
Absolutely, and that is why we're all here today. So looking also at that list, something that was interesting, and I'm not sure that you have an answer for that, but Lisa Hitch, sort of up near the top, recognized that the single mother household as well as two-parent households were mentioned, but single father households were excluded from the data. And I'm not sure if you know why that is.
I do not know why that is. I suspect it has something to do with the large proportion of single mother head of households in low-income families.
Yeah, I didn't think you actually had a response, but just an interesting observation. I think a few folks are recognizing one that kind of jumped out at me when we first started working on this presentation with the untreated cavities. And, you know, I never thought of that as a health issue that would impact students' educational performance. And yet here it is as something that is impacting students. So that was a surprise to me.
Uh-huh.
Well, this is great. So we all have sort of the landscape. What are the issues and where are we entering this next part of the presentation? So we're going to move this poll off the screen and get you started talking about the research on some of these topics.
So what does the research tell us? What we're going to be focusing on now is really how and why these health problems limit motivation and ability to learn. It's based on scientific research largely published in the past 10 to 15 years, and it comes from fields ranging from neurosciences and child development to epidemiology and public health. And the research shows that when these factors are addressed, the results are seen in educational outcomes, including reduced absenteeism, greater school connectedness, and improved academic performance. This is why reducing these health disparities must be a fundamental part of school reform. I've identified at least 5 causal pathways through which health problems affect educational outcomes. Sensory perceptions means seeing and hearing well. Cognition pertains to thinking skills, memory, focusing attention, solving problems. School connectedness and engagement is a big one. Does the student feel that their peers and adults in the school, including not only teachers but school staff, care about them as a person as well as a student? Is the school a place where they feel like they belong and want to be? If so, that is a very powerful influence on student success. Connectedness creates a school climate that cultivates motivation and engagement, without which youth will have a difficult time mastering basic academic skills when they are young, such as reading, writing, and arithmetic. Lack of connectedness becomes even more important during the challenging years of adolescence. Absenteeism is a huge issue. According to Attendance Works, which is a great organization that we should add to our list of resources, and I quote, across the country, an estimated 5 million to 7.5 million students are missing nearly a month of school and suffering academically for it. The problem starts early. At least 10% of kindergartners and first graders miss that much school, absences that can stall their progress in reading and deny them equal opportunity to learn. Chronic absence flares again in middle and high school when it becomes an early warning sign that students will drop out. Children from low-income families and communities of color and those with disabilities are disproportionately affected. So absenteeism is a huge issue, and temporarily or permanently dropping out of school affects the rest of one's life. What I'd like to do is go through each of these pathways and give some research-based examples. And one of the things that I'd like you to notice as we talk about each one is that each of these pathways is affected by multiple health problems. And I'm going to come back to that point a little bit later. But here, vision problems such as hyperopia, the ability to see at near distance, is inversely associated with acquiring literacy skills. Eye tracking skills are associated with learning how to spell and learning how to read. Youth with ADHD not only appear to have more ophthalmic problems, but sensory impairments in the perception of time and basic timing mechanisms, which are associated with memory, and with organizing and planning sequenced actions, like solving an algebra problem or writing a story, first, then, finally. Look at cognition. It's affected by so many of these health issues. Visual motor integration, unlike sensory perceptions, is the connections between our eyes and our brain. It's associated with reading, math, spelling, as well as standardized test scores. Exposure to violence is associated with intrusive thoughts, impulsiveness, and off-task behavior. Disruptive behavior influences teaching, and therefore learning for all the students. Physical activity. Recent advances in molecular biology and neurosciences detailing the causal mechanisms through which physical activity influences brain chemistry and cognitive function have explained what the Greeks knew intuitively thousands of years ago. The strong mind and body are intimately related. Breakfast is associated with alertness, attention, memory, problem solving, and mathematics. It's not surprising that principals send home notes before testing days reminding families to make sure their child eats a good breakfast on test day. Does your school send a note home advising parents to make sure children eat a good breakfast and get a good night's sleep before the test? It's also a good idea on those other 179 days in the school year when the students are trying to learn. ADHD is associated with problems of executive functioning, memory, visual attention, recall of factual information, and comprehension. Both asthma and ADHD cause sleep disruption, which impairs cognitive functioning. Sleep warrants a great deal of attention by educators for at least two reasons. First, there's unequivocal evidence that sleep has powerful effects on memory and ability to pay attention. Sleep is needed to protect and preserve the health of our brain. Second, the overwhelming majority of high school students in America do not get a sufficient amount of sleep. Anyone who has had a toothache knows that if a child is experiencing dental pain, it will interfere with learning. Connectedness. There's a compelling body of research demonstrating that connectedness and engagement with school is a key determinant of academic achievement and educational attainment, as well as child and adolescent health. Uncorrected vision problems cannot be overcome by simply trying harder. No matter how hard the child tries, they still continue to fail. The result is that they become demoralized by ongoing struggle coupled with lack of academic success, and that increases the chances of disengagement from school. Adolescents with higher levels of sleepiness, commonly caused by poorly controlled asthma and ADHD, are also less involved in school. Depression, anxiety, and psychological problems that often co-occur with poorly controlled asthma and with ADHD can interfere with forming close relationships. The social and psychological climate and safety of the physical environment, the degree of aggression and violence, influence the likelihood of school connectedness. If you go to a school where there's bullying, it's not a place where you want to be. In contrast, it's a place where you want to get away from. Being physically active and eating breakfast regularly can enhance mental health, which in turn increases opportunity for school connectedness. One of the most tragic consequences of ADHD is its effect on social relationships, such as lack of close friends, rejection by peers, and problems with adults. Absenteeism obviously affects opportunities to learn and grow academically and socially. We know for sure that poorly controlled asthma causes absenteeism. The slide previously shown indicated that almost 1 in 10 Hispanic high school students in America and 6.6% of black students miss one or more of the past 30 school days because feeling unsafe at school or while traveling to or from school. Physical activity can favorably affect the health status of students with asthma and thereby help reduce absenteeism among millions of youth with this chronic condition. Participation in school breakfast has also been associated with reduced absenteeism. In contrast, ADHD is associated with absenteeism and lateness, which may be due in part to sleep disruption. Dropout affects life trajectories. Teen pregnancy is strongly associated with school dropout, even after adjusting for other known covariant causes. Teen mothers are 10 to 12% less likely to complete high school and have a 14 to 29% lower odds of attending college. Youth with ADHD are more than twice as likely to drop out from school. So before we move on to the next poll, it just seems overwhelmingly clear that health problems limit opportunities for teaching and learning. Which one of these issues have you seen?
Great, that's helpful, Chuck. We're going to let folks know that we'll put up another poll, and as we've gone into this next section of talking a little bit about this connection between the health issues and the outcomes, we'd like to hear from you all what you find affecting the students in your community. While you're typing that up, one question we had somewhat related to one of the slides, you were talking a lot about school, about breakfast and the importance of students having breakfast, and this issue that there are many students coming to school without breakfast. One of the questions we had from a participant was related to this issue of not being able to afford food. Can you talk a little bit about that and whether there are programs in place to support those families that may not be able to afford food?
Yes, hunger is a huge problem in America, and there are several programs to address this need. At the federal level, the school breakfast and school lunch programs are two examples of that, but the participation rates in those programs is sometimes much lower than it should be, and that's why school breakfast is one of the things we're going to talk more about. There's also the SNAP program, the Supplemental Nutrition Assistance Program, the TFAP program, the Emergency Food Assistance Program, the Commodity Supplemental Food Program, and Child and Adult Care Food Program, the WIC program. So there's a variety of different federal programs. There's also state and local programs, and those are going to vary from one community to another. But despite all of these programs, having access to them and taking advantage of them is not always the same thing. So we have to find better ways to improve their availability and accessibility to the people that need them.
Thank you for that. That's helpful. Looking here at the list, it's a little sobering. A lot of people are saying they see all of these issues in their communities. Others, I'm seeing quite a few asthma and ADHD, a few related to violence and mental health issues.
And typically when you speak with school nurses, they will tell you that the mental and emotional health issues are among the most common issues that they see. And that's why I think we really have to focus on this thematically. No matter what else we're doing, that has to be a part of an effective program.
That is a great recommendation. I know you'll talk to us a little bit more about that as we move through.
I will.
I see a few folks putting their comments in the parking lot, and we'll try to attend to those as we go. If you have a response to the question that we have, you can put it right here in the poll box. And just sort of a side note, we will have an archive of the polls, the responses you all are providing, so that will be provided after the event. As we get into some of the other polls, there might be responses that you find useful and want to refer back to those. So, sure, go ahead.
I was going to just say, so I see Natalie asked the question, she just wrote childhood obesity. And yeah, I want to come back to the idea that the list that we have here is an illustration to show a set of factors that's prevalent, disproportionately affects urban minority kids, that there's causal evidence, that it influences educational outcomes, and that there are school-based programs that have been shown to be promising or proven effectiveness in addressing them. The idea is not to get hung up on what the list should be or to think that there's one list that everybody should follow. The idea is to encourage people in schools to incorporate addressing children's health needs as part of what they do to help them get better access to educational opportunities. And there may be lots of different things that schools in different communities want to address. Diane just put drug use on the list. Tobacco might be on the list. Obesity might be on the list. Injuries may be on the list. There can be lots of other things that particular communities see as priorities in their community. And that's exactly what should be happening. The point here is really to take a scan of the research literature and illustrate a set of health issues that warrant consideration and show how and why they affect outcomes through these causal pathways. And what we're about to move into now is to illustrate examples of promising or proven programs that have been implemented in schools to deal with these problems?
Absolutely. So I think that that's a good segue into the next section on topic and practice. So we'll talk more about how schools are tackling these issues.
Okay, so we can use more research to improve understanding about how schools can influence health and in turn students' motivation and ability to learn. But through decades of research, we already know what should be done and how it can be done effectively and efficiently. So the current problem is not that we don't know what to do, but rather that we are not doing what we already know. For the factors prioritized, here's some actions that illustrate what schools can do. So vision screening is quite common in schools. The problem is that in many cases, when a child fails a vision screening test, a note is sent home. And too many of those children may never get an eye exam, perhaps because the child's vision problem is not apparent. Children are incredibly adaptable. They learn to deal with their vision problem. And what we found is that when we rescreened large proportions of kindergartners who failed the vision screening in kindergarten and we rescreened them in first grade, a very high proportion of them failed again, indicating that they did not get the correction that they needed. So what we did is we piloted a program whereby, and this is all in Title I schools in New York City, we piloted a program where rather than just doing the vision screening, we had an optometrist at the school, and every child who failed the vision screening had an eye exam on the spot. And then what we did was we made 2 pairs of glasses for the child, one to take home and one to keep at school. And then we followed up with the parents and with the teachers. And then we came back a little while later and repeatedly observed the children in the classrooms. And we found that this approach resulted in doubling the rate of eyeglass use compared to schools that didn't have this. So vision is such a basic need for acquiring literacy skills and really learning in general that it seems like a very sensible investment to make sure that the kids in our schools can really see well enough so that they can learn. Now, asthma has been dealt with in a variety of ways. You see these examples of case management, elimination of triggers, education for students, and safe opportunities for physical activity. So the case management in part involves monitoring the attendance for students with asthma and whether they have symptoms at school. If they have high absenteeism rates and they're having exacerbations at school, it's kind of indicative that they may be having a problem not having the appropriate medication or need the medication changed, or something has to be improved because those things should not be happening. The other thing we can do is try to eliminate environmental triggers. That might be cleaning solvents, dust or mold, or even furry pets in the classroom can all trigger exacerbations. Education for students with asthma is important. There's a great program called Open Airways for Schools, and it's a program for children to help them learn self-management skills. And then also making sure that children with asthma don't have to sit out for physical activity, but they can participate in physical activity in a safe way. And on the CDC website, there's a program known as Asthma Friendly Schools, which was developed by the National Heart, Lung, and Blood Institute. And that's a really comprehensive resource that's worth looking at to help people in schools think about how to deal with the problem of asthma. Teen pregnancies or programs are most effective when they're intensive and focused on youth development and when they start early. They can help students develop aspirations to graduate from high school and attend college. They help them learn skills needed to succeed, including job skills and financial literacy skills. One of the best examples I know is a program that was developed by my friend Michael Carrera. The Carrera Adolescent Pregnancy Prevention Program, which is sponsored by the Children's Aid Society in New York City, has had great results and is one of the few programs with evidence of effectiveness. He's operating, I think, in about 22 states now. With respect to violence, we know that school-based violence prevention programs work. It's not controversial. You can go to the Centers for Disease Control website and see that. The best programs are ones that focus on the whole school and that help create a safe and supportive school climate. They teach young people skills to avoid conflict. Because most all of the conflict that occurs, it begins with emotions and it begins with words. And learning how to diffuse those situations are important skills for young people to learn. And then there are going to be some people who are going to need more intensive counseling and psychological and social services. Physical activity is a really important topic. There's very strong evidence that school-based physical activity programs contribute to academic success. If you want to see the evidence, just Google physical activity and academics and CDC, and you can read about the many studies that have come to that conclusion. But sadly, in too many cases, school leaders take time away from physical education to devote to instruction. Not only is there no evidence to support doing that, but the evidence is that we do have indicates that it will be counterproductive. A strong study by Matt Mahar at East Carolina University showed that short activity breaks in the morning and afternoon improves on-task learning behavior, especially for kids having trouble focusing on learning tasks. Physical activity can provide great opportunities in school. We can help the least active kids be more active. We can help youth learn to develop critical life skills, which have been shown to predict career success. Learning how to win, learning how to lose, persevering when success doesn't come easily, learning how to work together as a team, to be respectful and supportive. Do we do this, or do we tend to focus instead on competitive sports for the kids who are already most athletic? Universal breakfast programs work to increase participation. Many states lose millions of dollars a year for school food programs because low rates of participation. Since many kids face challenges getting to school on time, programs like breakfast in the classroom or grab and go can help ensure that they are not hungry once they do get to the classroom. Teachers are often the ones who realize that a student may need to be examined for issues related to inattention and hyperactivity. Many efforts related to this issue have worked in some ways, but have not done enough in helping students succeed academically and socially. A promising strategy developed by Greg Fabiano at the State University of New York at Buffalo is the daily report card. That increases communication between students, teachers, and parents. So there's different aspects of this work in schools. Some of it is assessment. Some of it is organizing classrooms to minimize distractions. Some of it is to improve the relationships between the teachers and the students. But a lot of it is really focusing more specifically on helping the student change their behavior and providing the academic tutoring and extra assistance the students need to succeed. And we have to do better outreach and partnerships with parents to do so. Likewise, with oral health, there's lots of things we already know how to do, and the challenge is to put these ideas into practice. So what are the conclusions that we can come to so far is that gaps in health disparities, addressing gaps in health disparities is an educational imperative. If we don't, the benefits of other efforts and investments are going to be jeopardized. If children can't see well, if their eyes don't integrate properly with their brain and motor systems, which they need to look at a blackboard and then write something down in their notes, they'll have difficulty acquiring basic and essential academic skills associated with reading, writing, spelling, and mathematics. If their ability to concentrate, use memory, and make decisions is impeded by ill nourishment or sedentary lifestyle, if they're distracted by negative feelings or fear about getting hassled in between classes, it will be more difficult for them to learn and succeed in school. If their relationships at school with peers and teachers are negative, they will be less likely to be connected with school and therefore less likely to be motivated and attend and less able to learn. If they are not in school because of uncontrolled asthma, ADHD, or because they're afraid to travel to or from school, they will miss teaching and learning opportunities. If they drop out, perhaps because they're failing or faltering, or because they're socialized to believe that even if they complete school, there will be no better opportunities, or because they become pregnant and there are no resources in place that enable them to complete school while pregnant and after they have a newborn, it is not likely that they can succeed. If they cannot focus attention and succeed socially, it is unlikely that they will succeed academically. Now, this next slide just has a few words on it, but it's a really important slide. One of the questions that I've been asked previously is, what's the most important thing to do? And it's really important that we realize that's the wrong question. One of the most important things to do is to recognize that there is not any one most important thing to do. While each of these health problems is individually significant, many youth are affected by more than one problem at a time. This is why if we focus on each problem separately, which is what we often do, we're not going to have large or consistent effects on educational outcomes. In contrast, when we address problems collectively, the resulting synergistic effects are much more powerful. We must address a set of priorities. The child who's well-nourished, physically active, and well-rested is going to have advantages regarding cognition compared with a child with deficits in any of these areas. The child who has difficulty seeing, difficulty paying attention, or is bullied at school will struggle to succeed academically and will feel less connected and engaged. In turn, the child who is less connected and engaged will be less motivated to attend. I've been doing a lot of the talking. At this point, we're interested in hearing from you about what are some of the strategies that have been put in place in your school.
Before we put that poll up, I want to call your attention, Chuck, to Michelle's question over there in the parking lot. And I think this is related to what we've been talking about and what we're asking folks to respond to here. She's asking how can she help parents deal with the statistics that you've shared early on without feeling like she's trying to tell them how to live their lives and their children's lives. Hopefully some of our participants will have some suggestions on this point, but I would be interested to hear your response to that.
Well, I think that you're certainly not going to be telling anyone how to live their lives and their children's lives. I think that ultimately what it comes down to is increasing awareness and interest about these issues. And it's one of the things I was going to mention later, but since it's come up, I'll mention it now, is while the message is important, another thing that's really important is who the message is coming from. And to the extent that our school leaders and other educational stakeholders really take a stand on these issues and help parents and others recognize why they're so important, it can really help to change the mindset we have. For example, people may think, well, it's only kindergarten. Why would it matter if a child misses a week here or there? Or things like that. So we have a large task facing us with respect to educating the public. And keep in mind, a lot of the strong research on these topics has only come out fairly recently, even though a lot of it is common sense. And then ultimately, we have to do our best to engage parents to the extent possible. Many parents and families are struggling. They're working multiple jobs. They have a lot of challenges of their own, but we have to do our best to make accurate information available and to communicate them through people that they trust and respect and reinforce these messages in multiple ways. And since you brought it up, I want to say, Michelle, it's like this is not something that you alone can do. These problems we're talking about, not only you as a teacher can do, but even schools alone it's not realistic to expect that they're going to be able to solve all these different problems. There's really going to be a need for involvement from different institutions and sectors within society. But if parents are consistently getting these messages from their teachers and from the school principals and from their pediatricians and from other places in the media perhaps, that can begin to change the mindset and change the beliefs and misconceptions that may be prevalent.
I think that is really helpful, and again takes us into some of the topics that you're going to be addressing as we go through the remaining slides. A big piece on communication, and we'll talk some more about some ways that communication can be used with families. And before we do that, let's look at this poll. We'll put up a box here, and we're interested in finding out from you all, what strategies have you seen put in place, either programs that you're directly involved with or programs that you have seen in your communities that are attempting to address these different health issues that we've been talking about. Another question while folks are working on that, some folks are actively discussing the topic on Twitter, and we have a question about sleep, Chuck. I know you've mentioned it, but can you talk to us a little bit more about the importance of students getting enough sleep and the effect on their educational outcomes?
Yes, sleep is a really important issue, and it's not an issue that's received sufficient attention. And there's a movement underway to help schools prioritize sleep and change the start times of schools. You can look that up. It's called startschoollater.net. And sleep is just critically important, as most of us kind of know from our own experience, but especially for children as and their developing brains. It has a very powerful effect on memory, which of course is central to succeeding in school. It also has powerful effects on attention and our emotional well-being. It comes down to increasing awareness and interest and helping policymakers recognize that starting too early hurts kids' chances for success, and involving a trusted and respected local individual to deliver that message can always help. So I'm glad we brought up sleep, because I think it's a very important subject. A short time ago, I think it was last year, I published an article which talked about the sleep patterns of high school students in America over the last decade. And what it showed was year after year after year after year, the overwhelming majority of high school students in America, and I'm talking over 90% now, really don't get the recommended levels of sleep. And I think it's a huge issue that really warrants more attention. So thank you for the question.
Another theme that I'm seeing, and this is mostly coming from the parking lot, starting with Lynn's comment about the recommendation from the American Academy of Pediatrics that there should be a school nurse in every school, and then Michelle's comment that her class on food and nutrition may be removed. This makes me think about staffing, and so the different types of roles that we have in schools that support some of these issues. You know, do we have enough staff? Do we have the right people? And comment here also in the parking lot that one suggestion is to partner with graduate programs in a variety of areas and use those folks for additional support. What can you tell us about staffing for tackling some of this, and what are schools doing or not doing well in this area?
I was going to get to all of these issues, but Lynn's comment is on target. The staffing issues are critically important, and I would say we are not even close to having the staffing levels that are required. And in New York City, there's a school nurse in every one of the schools, and even with the school nurse, and there are often other support staff, and either with the nurse and with the support staff, they are not even close to being able to meet the health needs that are being presented by the kids. And it's important to mention here, and this is what we're going to get into really coming up now, is how do you organize, recognizing that there's no way you have the staffing available to really meet all these needs. So how do you capitalize on the staff you have and try to help them function most effectively to benefit the most kids? I certainly agree school nurses have a critical role to play. They do play a critical role in helping children all over American schools, and they are a leader in this space. They can help minimize the effects of chronic disease. They can identify children with undiagnosed needs. They can provide professional development for teachers and school staff. They really need to be a key member of this leadership team. But you're absolutely right, Elizabeth. We just do not have sufficient staffing to address the needs we're talking about today in the schools that have the greatest needs.
And I would venture to say that another reason for that is funding, and we'll talk a little bit more about strategies for ensuring that decision makers have the right information in front of them to make decisions about these types of issues in terms of resources and support and programs. But at this time, let's take a look at some of these strategies. There's a lot of really interesting comments coming in from folks. Some programs, you know, they're just naming, but a few others here talk about some specifics. And Renee's comment that they're really working closely with the physicians in the community. So I think this is some of what you're going to talk about as we move forward in terms of coordinated support. And
yes, it is.
Support.
Yes. But Renee is absolutely right. I mean, what we need up until now, really, the education sector and the health sector have really been in separate silos, and that's not serving children and youth very well. So that's what we're trying to break down, and it's beginning to happen, and there's great examples like Renee is sharing, and in other places around the country where really educators and health professionals are working together, and it's having great effects.
I like Erin's suggestion or strategy that they're using, starting a girls group for middle and high school girls. I'm sure this is happening in a lot of places, sort of bridging that mental health piece with sort of the social aspect and bringing groups of students together. It really could be around anything, but healthy food choices, relationships, self-esteem, I think that, you know, those are happening, and how that then has an influence on these health issues that you're talking about, I think is important to draw that connection.
It's a great example, Erin, and another related one is a program called Girls on the Run, which is to get middle school girls together and get them to be more physically active, but it's also used to focus on these other social and emotional issues like relationships and self-esteem, and I think programs like that make a fantastic contribution.
Renee's other comment regarding parent workshops, and I know one of the questions we had in advance of today's webinar was related to families and how to engage families in these discussions. What have you seen that's been especially helpful in bringing parents into these conversations in terms of delivering the information? I know we talked a little bit about it already, but have you seen anything in your work that really stood out to you, Chuck?
Well, clearly we know that parent engagement is very challenging. As I said, parents are leading very busy lives and have many challenges and demands on them. What I've found that is very promising really revolves around improving communication. So there are certain now through different technology, simple technology applications, there's ways to promote texting. There's shared portals for parents and teachers where parents can easily check in and see what the homework assignments are or what issues maybe the teachers may be having with their child, or can easily communicate. So I think that a big advance would be to improve the level and specificity of communication between the teachers and other people in the schools and the parents, and make it easy for parents to have that interaction. Recognize that places a heavy burden and expectations on the teachers. So it's not necessarily that easy, and teachers, I have so much respect for teachers. They already have so many expectations on them, and they have such a challenging job. So we have to be cautious as we place additional demands on teachers to make sure that they also have the supports to make it feasible to use those kinds of technologies. The other thing I'll just say about that is that I've mentioned it before, and part of the message is the message itself, and the other part is who the message is coming from. So I think in reaching out to parents, if parents have communications from people in the communities who are trusted and respected, and it might not be somebody from the school, it might be from a business leader, it might be a religious leader, it might be a pediatrician or other health professional, and to the extent that those individuals are highly respected, I think it's more likely to elicit the kind of engagement that's going to be most helpful.
And somewhat tied to that comment, looking back up at Natalie's comment, judging from the comment, she's not based in the United States, but her comment is that the Ministry of Health is taking a look at the National School Feeding Program to make improvements. And we've seen similar initiatives at our federal level. You, I know, have been integrally involved in some of those discussions and the work in that area. So what can you tell us about some of this policy at the federal level and how those decisions and discussions really are flowing down to our local level and impacting how these issues are playing out in schools.
Well, okay, first to contextualize it, I mean, we should just remember that the United States is kind of unique in the world. You know, Canada as well we have a very decentralized control of our educational system. So in some countries where you might have, like at the federal level, people making a decision and then everybody follows in suit, in the United States, it's not going to go that way.
Chuck, are you still there? Okay, it looks like Chuck might have lost his audio. He's getting reconnected. So while he's doing that, I'll just comment on some of the other things I see here, and we'll get him back up and running in just a moment. I think the parking lot comments, Renee, echoing what Chuck was saying about the delivery and how important that is. I think that person who's respected and trusted in the community and the school community is so important. And sometimes that's not always the teacher that is able to make those connections with the family, but it might be someone else. So that coordinated effort. And then moving back over here into some of the comments that are in response to our poll question, it's great also to hear and see that parents are excited to learn about some of these things, especially the healthy nutrition. Sounds like quite a lot going on there in Newark, Renee. Have a lot of exciting work happening. All right, I'm going to move this poll off the screen.
All right, sorry about that. Can you hear me?
No worries. We can hear you, Chuck. I'm glad you're back. I was just wrapping up some of the comments on the responses we had there. You did cut out on your response to that last question, so I don't know if you can just pick up on that.
Where did I wasn't sure where it cut off, Elizabeth.
Gosh, now I'm even losing track of where we were. So maybe let's just move right along, and then we can get back to it if the topic comes up again.
Okay. So I've been doing work in this field for quite a while, and I'm glad to say that there's increasing recognition by policy-making groups that schools must address health factors as a fundamental part of their mission. Many organizations agree. For example, efforts are underway by the Association for Supervision and Curriculum Development, the National Education Association, the American Federation of Teachers, and many state and local education agencies. We were talking about the federal level initiatives and how the U.S. is different. I think that's right where we cut off. And what I was saying is, you know, unlike in many countries, in the U.S., there's a very decentralized control. So while federal initiatives have a tremendous role to play, but still most of the decisions are going to be made at the state and local level. But there's important roles for education agencies at the federal, state, and local level, and it would really help youth we're talking about if there was greater attention and involvement at all three of these levels. So, and while there is increasing attention, for the most part, I think there's still really insufficient investment of financial resources in the schools that have the greatest needs, and that's what we were just talking about a few minutes ago, is that the extent of needs is so great, and the schools just really can't be expected to address these needs without a really substantive infusion of personnel and other resources. The other thing that I've seen is in too many cases, the efforts are not strategically planned. There may be a program on one thing and a program on another thing, but when questions are raised about what's the rationale for doing one thing versus another, it's not always clearly and compelling reasons for that. The other things is, in too many cases, there's poor quality programs. In the past, some of the most widely implemented programs, school health programs in America, have had no evidence of effectiveness. And then lastly, really, programs are often not effectively coordinated. So what I'd like to do is I'd like to talk a little bit about these three issues of strategic planning, poor quality programs, and effective coordination. So strategic planning means that kind of what we talked about a little bit before is that there's no prescription, there's no one-size-fits-all, there's no checklist. This is complicated work, and it's going to be varied from one school to another. And what's going to be the priorities in a given school and community, or nation for that matter, should be based on analyzing the prevalence of the problems, who they affect, disproportionate rates in certain subgroups in one locality or region versus another. And it really has to be an ongoing process. It's not something that you do and then finish. It's something that's ongoing. And then I really want to emphasize that it's not reasonable to expect that schools can address these issues effectively alone. They really need involvement from the communities, and I'm going to talk more about that in a few minutes. While many programs have been implemented or have no evidence of effectiveness, there are a lot of programs out there that do have evidence of effectiveness, and it's important that we make those programs known to and available to people in schools that have interest in using them. These are some examples of tools available from the Centers for Disease Control to analyze health curriculum or physical activity curriculum, and the School Health Index really looks at, well, okay, as a starting point, where is your school at with respect to addressing the health needs of kids, and they provide a tool for doing so. There's a more recent version than the one there. And then there are certain evidence-based registries. The U.S. Department of Education has What Works. This is an example from the Substance Abuse Mental Health Services Administration. And there are lots of different ways to find evidence-based programs. This third issue, effective coordination, is one of the most important and challenging aspects of this work. Coordination involves different people playing different roles, but all working toward a common set of priorities. In the United States, the state of Tennessee is the only state that I know of in the country that has funded a school health coordinator in every one of the school districts. And that's a tremendous advantage. They have somebody who's designated just to be the coordinator, to realize that different people are doing different things, that there's these different funding streams from maybe Department of Agriculture and Department of Justice and different kinds of trying to focus on violence prevention or teen pregnancy, but they all really are going to be formed together into a cohesive effort that's going to reinforce consistent messages and help youth succeed. Another strategy to promote coordination is the School Health Council, and this is the group that takes responsibility for leadership in this area. And one of the things that really this is all about is it's all about political will. It's all about the commitment to really say this is going to be a priority. This is going to be part of our mission. This is not going to be something that we're going to do as an extra. This is going to be fundamentally part of our mission. And getting the right people on that school health council can really help ensure that you have that political will. There's really a need for involvement from the community. The community from one place or another can provide lots of opportunities to help support the school's efforts. Another person had mentioned colleges and what colleges can do, and that's a great example. But from one community to another, there may be, I've seen great programs by seniors, senior centers, and retired folks have volunteered and made tremendous contributions. So from one community to another, there may be different kinds of resources that can really make phenomenal contributions in helping meet the needs we're talking about. And then, there's a real need for coordination of services, linking the efforts together to help ensure the educational benefit. So let me give you an example. Vision screening is widely practiced in the nation's schools, as I mentioned, but the benefits are compromised by lack of coordination and follow-up. In New York, screening is done by the health department, typically a notice sent home advising that the child gets an eye exam if they fail the screening. Parents must ensure that the eye exam is received, and if necessary, corrective lenses are obtained and replaced if lost or broken, and are used at home. Students may not want to wear the glasses if the other kids make fun of them. Teachers must ensure that students use their glasses as recommended for near work, far work, or both. So it's easy to see how what may seem like an obvious and straightforward need, like getting kids the glasses they need, turns out to be quite complicated and can result in a child struggling to read because she cannot see well. And the factors I'm talking about may be particularly exacerbated for children with special needs, for whom the result of the vision test may say could not test. Well, there are ways around that if we have the political will and the determination to do something about them. So what we have right now is this is our approach in too many cases. We have these problems related to health, education, and social services that are all interrelated in these reciprocal ways. But our solutions, our programs and services, our policies, our research, our human capital programs, our funding streams are all in these silos. And not only are there silos within the silos. And that doesn't use limited resources like time and money and personnel very well. So there are some efforts to try to overcome that. This is an example of the coordinated school health program model advocated by the Centers for Disease Control. And it begins to break down the silos and to get different people from different components to work together in a high quality and strategically planned way. The newest version of the CDC's model is called the whole community, whole school, whole child model. And again, it has many of the same components. And you see the community on the outside really has to be brought in. And the goal is to help ensure that children are healthy, safe, engaged, supported, and challenged. And now I'd like to talk in the final portion of our session today about some action steps. And what can we do? What are the action steps we can take? Well, we've mentioned involvement a couple of times, but I want to really emphasize that I see it as really the key to our progress. The best way to develop school health programs that will be accepted and feasible is to involve local leaders and educational stakeholders in selecting priorities and deciding on the course of action. There's a little typo there on the slide. Sorry about that. So many programs don't work because they're not acceptable to the local stakeholders. And if that's not dealt with, then we just are not going to succeed. The programs that we're asking people to do have to be acceptable. They have to be consistent with their values. They have to be consistent with what they see as their roles. They have to believe in them and think that they're important. And if they don't, it's unlikely that we're going to succeed. Feasibility is a really big issue. As we've already kind of mentioned, there are often not sufficient resources in place. At the same time, in too many cases, the programs might be too time-consuming, too costly, too complicated. If so, they're not going to be used. They might require space or facilities that are not available. If so, they are not going to be used. They might require highly trained personnel, and they're not available, they're not going to be used. So we really have to take advantage of the resources that we have. Now, I wanted to mention, you alluded to a couple weeks ago, I had the honor to moderate a discussion at the White House on behalf of the National Education Association, and the event was entitled Champions of Change, recognizing individuals for their outstanding contributions to students, families, and communities. And the champions included wonderful people who have been and continue to enrich the lives of students in their communities. And I'd like to just give you an example to talk about the kinds of resources that might be present in our communities, and we might not see them so easily. But one was a bus driver from Wisconsin who started a program to give away books and encouraged older children to read to younger children. Another was a special education teaching assistant who mobilized youth in her school to help provide food to homeless families. Another was a custodian who went out of her way to get to know the students in her school who were left behind at the end of the day and didn't have a place to go. She connected with them. She made them feel valued. She truly cared about them. She helped them succeed. There was a substitute teaching coordinator who demanded high expectations from students, yet responded with empathy when they sometimes did not succeed. There was a groundskeeper who worked with his church to organize after-school and summer events to prevent the summer slide in students' learning. There are people like this in schools all over America. These individuals made outstanding contributions to the psychological and social climate in their schools. A meaningful daily greeting, a smile can go such a long way to help a child feel connected, feel like they belong, feel like school is a place where people care about them as a person. Each of these individuals made an outstanding contribution to his or her school. I want to close the session today by just talking about a variety of strategies. We kind of mentioned communication briefly. We should not underestimate its importance of strong communication. We have to keep talking about these issues and keep them on the agenda. Who the communication is coming from is as important as the message itself. So to the extent we can involve people who are trusted and respected to speak out about these issues, real progress is more likely to be made. Policy and accountability structures are one of the most important elements of reducing students' health barriers to learning. If we don't measure it, it's not surprising that people may feel it must not be very important. The kinds of policies that are most appropriate in a given school or school system will depend on many factors. Some examples of policies that warrant consideration are integrating health-related measures into school improvement plans, including these goals in the plans, trying to have some accountability metrics for health-related objectives, establishing a school health council or leadership team, making sure there's time in the curriculum to pay attention to these issues, and not forgetting about the need for professional development of staff and the adoption of specific policies. People have not learned all the skills necessary to implement these kinds of programs. They need help. State departments of education can be particularly helpful. They can provide intensive efforts to disseminate up-to-date evidence-based programs. They can provide ongoing follow-up and consultation. and they can support school health learning communities. And I believe REL is doing that. We actually had an error on this last slide. Sorry about that. We'll have to correct that, Elizabeth. I wanted to just talk briefly about professional development. And this is desperately needed for school leaders, teachers, and support staff to create effective and efficient programs. It's not surprising that school personnel often feel unprepared to meet these needs. They've not been trained to address the kinds of problems like this in their professional preparation. And as I said before, it's not realistic to expect they can meet these needs without help from health professionals specialized in dealing with vision, asthma, inattention, and hyperactivity or oral health. School leaders must understand how to identify and address health barriers to learning and what kinds of help they need. Teachers have a central role to play. Can they identify a child struggling to see? Are they attentive to the child who may be sleep deprived? Can they prevent and manage disruptive behavior in their classroom? Can they create a psychological and social climate in their classroom where students feel safe, comfortable, and engaged in learning? It's not always that easy. Professional development is not only needed for existing personnel, but to prepare a new kind of education professional who plays a coordinative role, who recognizes that there's many different people in the school and community playing different roles, but who are working together to help you succeed socially and academically. Fortunately, there are many great resources available to school personnel to help in develop these kinds of programs. The Centers for Disease Control and Prevention is a good example, as well as Attendance Works, the School-Based Health Alliance, the Association for Supervision and Curriculum Development are some examples, and there are a variety of evidence-based registries. So I have been doing research and publishing papers for over 30 years, and it's clear that good studies always lead to more questions. And while there will always be opportunities to improve understanding about the links between health and education, the priority now is not to do more research to learn what to do. In contrast, the research priority now is to put into practice what we already know. Some examples that I think warrant consideration are to determine ways to cultivate political will among elected officials and education stakeholders to address these persistent health barriers to learning, to assess workforce preparedness to address health priorities, and to evaluate the effects of specific health policies. What data we collect is important. Until we collect accountability behavior on these factors, schools will be less likely to take them seriously. There is an important role to be played by colleges of education in preparing the next generation of teachers and leaders. They need a different set of knowledge and skills. As greater expectations are placed on teachers and school leaders to address these needs, the programs preparing them have a responsibility to increase the integration of these health topics into the programs. So in wrapping up, I just would like to say health factors clearly influence the quality of life for youth and their ability to contribute and live productively in a democratic society. Improving the health of youth is a worthy goal for elementary and secondary education. Indeed, pursuing this goal is both a moral and educational imperative. While the challenges ahead are significant, what always gives me inspiration is when I walk into an elementary school in a neighborhood where lots of people are living below the poverty level. And what I see are children with bright eyes who have potential to contribute to the vitality of America. Children who, despite living in shelters, being hungry, having problems with their vision, having problems with illness and sleep, who may spend a lot of their days and nights not feeling safe, yet they come to school to engage with their classmates and to learn. Elizabeth, thank you very much, and thank you very much to all of you who stayed with me through this talk. I really appreciate the opportunity to share this message with you, and I look forward to working with any of you who have an interest.
Thank you so much, Chuck. We do have some time, so we're going to finish up with our last set of questions for the audience, and then we'll be opening it up for some more questions. I do have a few additional questions that we didn't get to address yet from what folks asked ahead of the webinar, and I want to make sure that we get to those. But before we do that, you're going to see two different polls come up on your screen. One asks for your response about what your key takeaways from today's presentation are, and the other is related to action steps and what action steps you might be taking as a result of today's webinar. As with all of our webinars in this Educator Effectiveness series, we really urge folks to think about what you learned today and take some action in your settings. So hopefully you've learned something from the content of what Chuck has described to you, or through the connection with other educators, other participants in today's webinar. So sharing your ideas is really helpful across our states and even countries, as we have many folks who do attend from other countries. While we're giving folks a chance to look at those questions and make a response, Chuck, I don't think when you reconnected, I don't think you're able to see, so I'll help facilitate some discussion around those comments. But I do want to read Renee's comment in the parking lot. She says that you encourage people to become educated voters and to know how their candidates feel about funding health-related programs, public education, etc. I'm an elected official in Montclair, and they tend to be an educated group of voters. This is how to make sure to get folks who will be on board with our recommendations. Great point. I don't know if you have a comment on that, Chuck.
Great point. I mean, I think, as I said, I think at this point it's really about political will. It's not that we have all the answers. These are complex problems, but we can really make significant progress toward addressing these problems if we have the political will to make them a priority. And for that, we really need to have the support of our elected officials. And that support has to go beyond the rhetoric, because nobody really speaks out against these issues, but that support has to be in the form of keeping the issues on the agenda and allocating the resources that are required to meet needs in a realistic way.
And you talked about it, but I think it's worth repeating that school administrators at all levels really need to be part of that conversation, because as we talk about the allocation of resources, both human and financial, it's important to note that administrators a lot of times hold that decision-making power. And if those conversations, if they're involved in those conversations, that value is there within their community, they can make decisions that meet those needs.
Absolutely. And what I've found to be, I mean, in many of the schools, what I've found is the principals, they know. They see these problems on a daily basis, and they know they need help to meeting them. What I found is people don't see that and don't have that perspective, really just showing them the data that demonstrates that not addressing these health barriers is going to jeopardize the other investments they're making in teacher effectiveness, in professional development, in curriculum reform, and accountability, and assessments and standards. All those things are important, but the benefits of them become limited if the students aren't motivated and able to learn. So really just making that point over and over again, and not presenting it as an opinion, but presenting it as really compelling scientific evidence that's been accumulated from neuroscientists and epidemiologists and child development specialists and educators can really help change people's mindset about where these issues and these kinds of programs should fit in to the school system in America, especially in Title I schools.
Absolutely, and that transitions me into Michelle's comment and key takeaways, the importance of getting the whole community, whole school to create the whole child. I think that is important and an important message. We say it, but do we mean it, and do we put our resources and our programs in place to emphasize that philosophy?
I think in too many cases we don't. I think in too many cases there's a big difference between the rhetoric and the reality. And I think a lot of times people have good intentions, but these are not simple problems that are going to be easily solved through single solutions. There's really a need to make a long-term commitment. Just as a parent makes a long-term commitment to raising their children, addressing these needs in a school system and community is going to require an ongoing and really permanent commitment, because there's going to be constantly changing needs, and there's going to be constantly changing personnel due to turnover in the schools and people coming from different communities into and leaving the community. So there's a need for constantly revisiting what the priorities should be and making it important. And it's happening in some places, and it's happening to a greater degree now, perhaps than ever before, but there's a long way to go.
That takes us into the comment that Corey makes regarding also takeaways. It's important to look beyond teachers in the classroom. Support staff are equally important in increasing the feeling of belonging and perhaps addressing health-related barriers to learning. And I know this is something you mentioned in our discussions before today's webinar, that the other education support staff are so critical to making inroads on some of this that, you know, we can't underestimate the variety of roles that folks serve in and how they can influence some of these issues.
A couple of weeks ago when I was at the White House, and these people who were bus drivers and custodians and teaching assistants and technology specialists and groundskeepers were being brought in to recognize their contributions, I was just so humbled by how much they knew in their collective ingenuity, and their individual ingenuity and their collective ingenuity about what was really important in making the school a great school. And these individuals made such amazing contributions. It was very, very humbling for me. And I think there are people like that in communities and schools all over America, and we should do a better job of recognizing their contributions and on capitalizing on the many things that they have to offer and the many contributions that they can make. And absolutely agree that the education support staff in the nation's schools really can be mobilized to a great degree to move this agenda forward.
And to add to that, a few other of the comments really relate to that piece about engaging a variety of stakeholders. So Tina and Tracy both mention here working with parents. So on one end, Tina says educating parents, and on other side, Tracy suggests working with parents on these issues. So how can we both educate and engage and make them part of the solution to some of these problems, I think is really a helpful takeaway. Alexandra also talks about this piece you mentioned at the end in engaging our higher education institutions to talk more about how can we ensure that our future teachers, administrators, and support personnel have the skills and abilities needed to tackle these issues and to enter schools and to continue in their work in schools in ways that can support the solutions that we've been talking about.
It's a desperately needed issue to really influence that. And the other thing is the colleges and universities throughout America have a tremendous role to play. They're the home to literally millions of students, and many of those students really want to make a contribution. They want to find a way to make a difference in their life where they can make a contribution and be helpful. So having the schools providing those opportunities for service learning projects is a great opportunity that I don't think we're even close to taking advantage of. And another topic I'll just mention briefly, because I know you have an upcoming webinar about it, is this whole idea of developing a professional learning community. There's no easy answers here, and the kinds of answers that may work in one school and community may not work so well in another. So what we really need to do here is to cultivate a community of learners who can share and learn from one another, because that's really where the benefits are going to come from. There's a big emphasis on what's called evidence-based practice. So we have these programs that are studied, and then we thought, okay, well, those are the things we should invest in. And I agree, that's an important thing to keep in mind. But in addition to evidence-based practice, one of the things that I really strongly believe in is practice-based evidence. And that is the people who are on the front lines, the people who are working in the schools day in and day out and are dealing with these problems and going to sleep at night thinking about these problems, really have a lot to share and a lot to offer in finding ways that they can be solved or at least minimized.
And I think that that's really what folks are walking away with today. In the poll question related to the action steps, I'm seeing a lot of folks inspired to go out and be advocates in their communities, to take what they learned today, but also to continue to do research and learn more and engage with others. I like Natalie's comment about networking, and I think networking is an important piece of this, is bringing together what might seem like varied groups of people with this common interest in influencing change on these health issues, because it then has an impact on educational outcomes in addition to other outcomes. But engaging folks who might not be the ones that you initially think.
I completely agree.
So this is wonderful, and like I said, we'll have an archive of this so you all can take a look at the comments that others made if that will be useful to you in your work. I'm going to pull those off the screen now, and we're going to start to wrap up for today. We'll put up this Q&A pod so that you can ask any additional questions you might have for Dr. Basch. We'll have a few minutes to address those. While we put that up and let folks post any questions you might still have, we did have a few that we didn't quite get to yet, and I'm going to check in. One, and I know we talked a lot about communication, Chuck, but one of the questions we had was related to utilizing technology to support health and academics in school and home settings. Can you talk to us a little bit about that piece and how technology can be used as an asset?
Well, one of the things that, the nature of our communication has changed so much in, the last 10 to 20 years. And now the way people share information is through their phone. It's through texting. It's through Twitter. It's through social media. So these communication channels have tremendous opportunity, potential for contributing to this agenda in many different ways. There are programs now that make it easy for parents and teachers to text back and forth with one another. There are programs now that involve a portal where parents can check in and they can see what are the homework assignments that children have. They can see what are the attendance records their children have. They can see what are the grades that the children have. One of the areas in technology that I think so far has not really been fully tapped has to do with using technology for better integration of existing information systems containing health and educational data. The use of what's called early warning systems is pretty widespread. Those early warning systems are intended to try to identify children that may be exhibiting problems for failure. And they typically include metrics like attendance, behavior problems or issues, and course performance. But what they don't include is any of the health-related data. So, for example, it would be useful for a teacher to know, which children in their classrooms need glasses, which children in their classrooms may have other special kinds of health needs. How can we make sure that if a student with asthma is identified, that they have a medication administration form on file with the school? How do we know the kinds of environmental triggers that might evoke an exacerbation or an asthma attack in the school? So integrating these data systems, which right now live in very, very separate silos, is a really untapped potential. Hello? Hello?
Hi, Chuck. Are you there?
Yeah, can you hear me?
I can hear you. Sorry, we're having some technical difficulties here.
Yeah, sorry. I don't know at what point you lost me, but I was just talking about the need to integrate health and education data systems.
Great. Yep, I heard all of that.
Okay.
Super. So I think we've addressed all of the questions. Folks had some more logistic questions over there in the parking lot, but I'm going to move us through a couple of additional slides to talk about some next steps, and we'll let folks get on their way for today.
Okay, Elizabeth, again, thanks so much.
Thank you. And folks on the line, there's our contact information. If you have general questions about the webinar series, you can be in touch with me or our general REL Mid-Atlantic email. If you have specific questions for Dr. Basch on today's topic, he'd be glad to respond at his email. You can continue the conversation at Twitter, and you can find out more about our webinar series at Facebook. And we do hope you'll plan to attend some of our upcoming events. You'll see those listed here, and you should receive an invitation to these events through email if you participate in our events like you have today. Our upcoming topic that later this month is related to curriculum and lesson development for English learners, and then we'll take a little break while folks are on summer vacation and coming back in August on the topic that Chuck mentioned, professional learning communities. So we do hope to see you again at one of those events. And our webinars are really driven by your feedback, and we want to make sure that we respond to the participant positive and negative feedback that we receive. So we hope that you'll take a few minutes to fulfill our evaluation. You should see that coming up in a window on your screen. That's also where you can, once you complete the evaluation, you'll be able to print out the certificate for today's event. So at this time, I'd like to just give a virtual round of applause to Chuck for his time in creating today's presentation and for delivering this really high quality information and having this discussion with us. I know that you all will be taking this back to your communities, and we appreciate your participation with us. So thank you, Chuck, for your time.
My pleasure, Elizabeth. Thank you.